Hello, I will be presenting our next speaker. Dr. Tyce Nadrich is a counselor educator, professional counselor, supervisor, and consultant. He earned his PhD in counseling from Montclair State University, his MSED in clinical mental health counseling from St. John's University, and his BA in psychology from the City University of New York, Queens College. He is currently an associate professor of counseling and the program coordinator of the clinical mental health counseling program at Mercer University in Atlanta, Georgia. He is a licensed professional counselor, approved clinical supervisor, and national certified counselor. He currently serves as a professional counselor and the coordinator of clinical training at Balance Mental Health Counseling in Huntington, New York. He provides therapeutic services to individuals and couples, specifically people identifying with historically marginalized identities, as well as parents and couples seeking to foster wellness and satisfaction. He also facilitates supervisory services for interns, counselors in training, and licensed professional counselors. His research interests include racially ambiguous and multiracial mental health and parental mental health, specifically paternal mental health. He has published multiple peer-reviewed articles and book chapters on mental health and counselor education, and has facilitated numerous professional presentations at local, regional, and national conferences focused on mental health and education. He is an active member of various professional organizations, including the American Counseling Association and the Association for Counselor Education and Supervision. If everyone could please give a warm welcome to Dr. Tyce Nadrich.
Good afternoon, everybody. That made me sound busy. I don't like that. All right, let me try to figure out what I'm doing here with these slides. That's me. Okay. Hey, everybody. So I'm going to do a couple of things here. The first thing I'm thinking about, though, is that I'm looking at the time, and you all have a break after this. So I'm going to try to move things up so you all can reclaim your break, and we'll see how this goes. I'm going to try to keep the pace going here. But as was said, I'm going to talk about paternal mental health today. I'm going to go through my agenda, but then before we get into it, I want to ground what we're doing today so that we're all on the same page with a few things. So this is where I'll go through. I'll introduce everything. We'll talk about fatherhood. We'll talk about my clinical practice. We'll talk about some research that I'm doing, and then I'll hopefully leave folks with some direct ideas about what to do with what I'm sharing today. But I want to ground everything so that we're all on the same page. Now, when I was initially approached about speaking today, I want to be very clear. I saw that the title was Maternal Health in this conference here, so I'm acknowledging that. And while I'm not going to talk directly that much about moms and birth givers in this situation, I want to be very clear. I'm talking about moms and caretakers and birth givers in this situation too, because for those of you who have been in any relationship, whether it be one where there are children involved or just any type of relationship, my hunch is that when your partner was cranky, it probably impacted you in some way. If your partner was depressed, it probably impacted you some way. I don't think it's a huge leap to know that if in this situation, dads are experiencing some form of mental health distress, it is going to have a direct impact on moms. I think acknowledging that loop is an important grounding piece for us, because while I'm not talking about moms, I'm talking about moms in many regard. I also want to emphasize, nothing I'm sharing here today takes anything away from moms. Full stop. I think we can hopefully do both, meaning take care of our mothers and also try to open doors for our fathers. The other piece that I want to also highlight as I'm talking about this is much of what I'm going to do today is very heteronormative. Now, that means I'm not going to be talking about queer dads or queer couples or LGBT. I'm not doing that today. That doesn't mean we shouldn't be doing that. It just means that's not what I'm doing today. That's not really where my research has been, although my clinical practice is very much there. That's not where my research has been, and we really lack research in that area. So while I'm not talking about that, we probably should be talking about that. eventually. So I just want to put that out there about what we are doing today and what we are doing or aren't doing today. Cool? Cool, appreciate that. All right, let's talk about dads. Let's talk about fatherhood. Here's the first thing that I want to highlight about fatherhood. First and foremost, this is something that most men throughout their lives highlight as a milestone, as a pivotal experience. This is a big deal to men. This is not something, despite what stereotypes and stigmas might say, it's not something that's very passing. For today's men, and really for the last couple of decades of history, when we've asked folks about what fatherhood means to them, it has been significant. It has been a big deal. I also like to highlight, I tend to operate from a positive perspective, so I like to highlight the positives here. Generally speaking, when we see we see men become fathers, what we typically see are some notable positive effects. We see folks renegotiating their relationship with food and physical activity. We see folks renegotiating their relationship with substances and risk-taking behaviors. Increases in sort of physical, in terms of positive attributes or positive things that you can engage with, and decreases in some of those negative things. These are statistics, so you all know there's outliers out there, but generally speaking, we see more positive effects for fathers than negative. Something else that I want to highlight here is there's a bit of a transition that I don't think is spoken about very much when it comes to fathers as they engage in fatherhood. Now, when it comes to moms, that transitionary period, it's very obvious. Most of the time you can see it, to be clear about that, but there's something very significant that happens. There is literally a child growing inside, and then you are holding that child at the end of the whole process. That doesn't happen the same way as it does for fathers. So a lot of that process happens covertly. And on top of it happening covertly, it also often happens in silence socially. We as society don't talk about what it means to become a father, usually not directly, at least. So what we find is that there's these big pieces there. Identity development and sort of finding your place within the world. I'm going to talk a little about both of them, but what does it mean for me to have this new identity? What does it mean for me to exist in a new system? I started this conversation talking about how this is all connected because I operate from a systems perspective. I'm a mental health counselor. I can't not think about the people who exist in the system. If I'm working with an individual, I'm not just working with the individual. I'm talking about all the systems that they occupy because those systems inform their experiences and they inform the experiences of others within that system. So what does it mean to exist in this new system as a father? What is my place within that new system? So to start grounding when it comes to that identity piece, first and foremost, this is not a linear process for fathers. They kind of just, like most people, as we go through life transitions, sometimes it's a little bumpy. Sometimes we take a detour. Sometimes we go this way or that way. And sort of the big three questions that I encourage mental health professionals to think about when you're engaging with dads about what it means to become a dad, to be a dad, to transition from one place to another place in terms of your fatherhood journey is thinking about the components of that identity. There's a theory that guides this here, and there's three components to it. The person of the father, the position of the father, and the symbol of the father. So the person of the father is really at the core who this individual is, who am I as a dad? What is my relationship now, this new label that I have within the world? The position is very practical. This is very much, what is my role? What should I be doing in this new place that I'm occupying? And the last piece is the symbol, and this is a big piece, I think, all big pieces, but what do I represent at this point? I might have represented or meant something. I might have symbolized something at this point in my life. And perhaps I symbolize something different. questions like this are important because they exist inside of us, whether we're thinking about them or not. They inform our lived experiences, whether we're thinking about them or not. So when I'm working with dads, I'm asking them questions about what it means to be you. What does it mean to exist in this home now that is significantly different from the home that it was a couple of months ago? What does it mean for you to walk the streets now with this new label that you have? Because it's a new label, it's a new identity that you carry with you all of the time. Are we asking ourselves those questions, or are we sort of pretending that we're not thinking about it? They are thinking about it usually. Historically, we've sort of found dads in some very specific boxes. And while I'm hanging out in history right now, I'm going to give you all some data about where dads are today in a little bit. But historically, we've really found fathers in certain big positions. The provider, the protector, the shared decision maker, the socializer, and the supporter. That's really the lane it is. And if I had to really emphasize some lanes, I'd really emphasize that provider and protector. That's where history has put folks in. The provider, the man or the father is meant to provide primarily financially, to be clear, and just folks know statistically that ain't the case no more. But that's been the historical narrative, is I am supposed to provide specifically financially. I am supposed to protect my family, specifically physically protect them. Not necessarily emotionally, but physically protect them. I'm supposed to be part of the decision-making process. I'm supposed to be within this. I am meant to socialize my child in a very specific way. I have to teach them lessons about what it means to exist in society. That is my role, that is my duty as a dad, as a man. And I have to support my partner in some capacity. That's what I have to do. Those are sort of the boxes that we allow fathers to exist, that we socialize and teach fathers to exist in, if they are taught, and again, to be clear, some are taught directly, some are taught indirectly. I'd argue a lot of these are taught indirectly, but these are the boxes. But even within, as I'm talking about those boxes, they're a bit limited. You know, we mentioned this idea of providing. Well, those narratives that we have, those stigmas that we have about the provider, they tend to be financial. They aren't necessarily emotional or chronological. Am I providing my family with my time? Am I providing my family with something emotional, comfort, engagement? Or am I just solely meant to provide financially? These are the types of narratives that have existed for decades that many men are stepping into fatherhood carrying. And yes, they have some onus on this. There needs to be some form of addressing on this. I'm a mental health counselor. I'm working with these folks. We're doing that together. And society has a bit of a role in this as well, because we uphold a lot of these narratives, sometimes directly and sometimes indirectly. The more aware we are as a collective of what these narratives are, the more we can think about their impact and where they are going. I can't talk about fatherhood without talking about masculinity. And this is going off of the piece that we shared, is when we think about fathers and men, we think about masculinity and what is perceived to be as a masculine role or a masculine task. And this is where those ideas of provider come in very strongly. A masculine male, and I'm doing air quotes, I'm not doing air quotes, but I'm doing air quotes, but a masculine man, a masculine father is one who financially provides. A masculine father is one who can procreate, doesn't have any issues with fertility or anything along those lines, doesn't have any issues with erectile dysfunction or anything along those lines. That would be antithesis of masculinity. A masculine man would prioritize the needs of others over the needs of themselves. They would be stoic. They don't have time, or they don't have the space to think about them. I have a job to do. I will put the responsibilities of others over my own. And we will reward, broadly, historically, we've rewarded masculinity in many regard. And I'm not saying you all did, I'm saying society did. And arguably, some ways we're doing it right now, I think, in terms of broad pictures. We've rewarded this type of masculinity. historically, even though I think it's fairly obvious that don't serve everybody involved in a family, and that arguably doesn't even serve necessarily the father or the man themselves. Because of that overlap that I'm highlighting there, we find that this directly connects with the way in which fathers and men engage in their families, within their systems, with their spouses and partners and birthing parents and their children directly. The ideas of masculinity, the stigmas attached to deviating from masculinity. And what does it mean to do so? Can I do so safely? Or will I be ridiculed if I acknowledge that I am something different than that? I do this often with my students when I'm teaching them, and I'm not asking anyone to say it, but you all know the words. We have words for men who deviate from these historical concepts of masculinity, and for the most part, they are pejoratives. And they're also just messed up words in general because they also tend to conflate other identities and pathologize those identities as well. But you all know what those words are. We have pejoratives for men who deviate from these historical concepts of masculinity. And even if you're not using them today, you still know what they mean because they exist in society. They are part of the narrative. I want to bring you all a bit to where we are today when it comes to men and masculinity and fatherhood, and just share some data and some observations with you all as we go through this. So, to be clear, when we look at any of the research that's out there about fatherhood today, fathers are doing a lot more today than they have historically. Those specific lanes that we've been highlighting, these ideas of being the financial provider and all that stuff, for multiple reasons, there's less of that rigidity there in terms of how folks are actually engaging. And fathers are doing more. Fathers are changing diapers. Fathers are engaged. Fathers are doing daycare pickup, all that good stuff. And I'll be honest, I'm doing all that stuff. I often talk about this, but I'm the one who's on all of those pre-K lines. I'm the one who does all of the, you name it. I'm on the PTO, PTA, whatever they call it. It was one spot in the other one. Now it's a PTO. It doesn't matter. But dads are doing more of that today than they have historically. And I want to remind folks that the historical stigmas still matter. I had a conversation recently with a friend of mine. I tell my friends, I'm relatively new to the state of Georgia, so most of my friends, if not all of my friends, are still back in New York, where I'm initially from. And I remember one day I was on the phone with a friend, we were talking about something, and I can't remember exactly what I said, because this happens frequently, unfortunately, but I mentioned having to go somewhere and the difficulty of what it meant to go do this chore, this thing with my daughter. And the immediate response was, well, why can't your wife take your kid? And I said, well, because she's working. I've got the flexibility to do this thing. But even the idea of, and remember, it was the tone. It was, well, what is she doing? Why are you doing that? There's a tone there of, well, I shouldn't be doing that. Because I don't know about you all, but people are at grocery stores all the time with all their kids sometimes. I only got 2. It's not that, let me be clear, it's a lot, but it's not as much as other. But this idea that it would be okay for my wife to go do X chore with the kids, but if I'm doing it, there's something off there. There's a connotation about what my work is supposed to be versus what her work is supposed to be. So even though dads are doing more today than they have historically, a lot of that stuff from the past and somewhat present still exists with us today. Also, we don't really do research on dads, at all. I want to be clear, we've done historical research on men, we've done that, and we have not done enough research on women for a very long time. But we don't fully really understand what's happening with dads specifically in today's context. And what we do know, though, from very few studies that we've done this with, is about 8 to 10% of dads are reporting that they're experiencing some form of mental health difficulty as they engage and embrace fatherhood, mainly anxiety and depression. And I would argue with you all, that is a huge underreporting. Because all that stuff I talked about with stigma and mental health before, my hunch is a lot of these dads are lying about how they feel. They are compartmentalizing how they feel. So if 8 to 10% are saying, yeah, I'm experiencing depression, yeah, I'm experiencing anxiety, my hunch is that number is a lot higher. Now, there's a lot of ways to go about this. I can talk about compartmentalization. I can talk about lack of emotional recognition and the ways in which that men aren't always taught to recognize their emotions. And oftentimes emotions like anxiety and depression will manifest in other ways that are a bit antithetical than anxiety and depression. This could be isolation. This could be substance use. There's a lot of different ways that these behaviors can manifest. Regardless, even if this is an accurate statistic, I still think 8 to 10% is pretty high. I think that's worth talking about. What we do know when we talk about dads is there are a few things that they've consistently spoken about when it comes to their mental health in that perinatal and postpartum period in terms of what's going on for them. They talked about the emotions connected to this idea that there is an intense emotionality that they're experiencing, that sometimes they're just unsure of what to do with. And oftentimes, those emotions are repressed and compartmentalized for a reason that's actually at the bottom of that little slide there, but we'll get to that one right there. They talk about family reorganization and transition, about the literal changes in the home. What does it mean to exist in this place now? What lane should I be in? Am I supposed to be in this room? Am I supposed to be doing this prep? Am I supposed to be going to work? Am I supposed to be staying home? What am I literally supposed to be doing now that we have brought this child home and the whole house is just, everything's just different. Everything across the board is different. They've talked about their identity development. That piece that I highlighted before about what does it mean to be me? What does it mean to be a dad? How do I know what I'm supposed to be if perhaps no one's ever told me? I haven't read a book about it. No one's ever shown me. I haven't had any conversations with the other men who have done this in my life. And in some cases, well, I've never been really engaged with a dad. I don't know. The only dads I know are the ones I've seen on TV. There's also that social expectations piece that we sort of laid a groundwork for. This idea of what does society think I'm supposed to be doing in moments like this. I have a client, actually now former client, he discharged recently, so I'm good for that. But I had a client, so I'm not saying I'm very large, but he's about 6'3", I'm about 6 foot, so he's about 6'3", black man, long locks, and he was walking with his daughter, she was in a stroller, walking with his daughter through the city, New York City. And at one point, a dog, small dog, he didn't know what breed it was, came up, off leash, ran up, bit him on the calf. And he got really upset. Understandably so. I think everyone's cool with that. Like, yeah, dog bit him on the calf, not cool. A woman came running after the dog, white woman I'll add, came running after the dog, grabbed the dog, apologized. He said, you need to put your dog on a leash. That is not cool. Remember, he's got his, I think she was less than a year. She was on a stroller at this point. At which point she minimized and said, it's not that big of a deal. You're fine. You'll be fine. She doesn't even bite that hard, et cetera, et cetera, et cetera. Now, in this moment, he had a decision to make. And we spent the whole session talking about this. He could yell at this human, who probably deserved to be yelled at, let them know about themselves. And what that would mean is that he, a fairly large statured black man, would be yelling at a white woman in the middle of New York City with his child. He carried the expectations in that moment of who he is supposed to be. He had to eat that. He had to repress that. He had to hold that. Because the risk of confronting this individual, who in my opinion probably deserved to be confronted, outweighed what it meant to actually do it. He couldn't risk police involvement. He couldn't risk bystander involvement. Things like that, while minor, are important to recognize that society expects certain things of everybody, men and fathers included. The last piece was the helping behaviors or the help-seeking behaviors. And oftentimes fathers are shown to deprioritize their needs, to not speak about what it is. The narrative of, it's not about me, it's about her, it's about them right now. And we're very clear, in many ways, it is about her and about them right now. And I would argue, what does it mean to also be about you? Do you fit in that equation? Are you allowed to feel anything in this moment? Or are you saying you literally are not allowed to feel emotions because you have a newborn? Or because your wife is postpartum or your partner is postpartum? If I say it that way, I'm pretty sure everyone's like, no, you're allowed to feel stuff. We don't want to take anything away from the mother, nor am I asking us to. Can we also make room for dads in moments like this? I want to talk a bit about my own clinical work and my research in this area in the hopes that it'll inform where we go from here. So I'm going to share some anecdotes from my clinical practice, and then I'll back it up with actual anecdotes from my research. And I think you'll see the alignment in terms of what we already know, what I'm doing in my practice with me and my supervisees, everything along those lines, and what my research is highlighting. So just for context, my introduction made me sound very busy, and I guess I am sometimes. My practice is based out of New York. I'm remote now, although I do go up quite frequently just to check in with folks and make sure everyone's doing all right stuff here. But I mostly, at this point in my career, work with younger adults to middle-aged adults, mostly couples who have recently had children or are trying to have children or are actively gestating children and all that, because that's usually the folks who I work with. I mostly work with folks of color, one because I want to, but also because there ain't that many black male therapists out here doing this work, so they usually come to see me for a reason. And in my practice, I supervise almost all of our clinicians, certainly the ones who are working with fathers and who are doing perinatal mental health or paternal mental health in some capacity. And what I've seen in my practice is a culture from men who deprioritize their needs so much when it comes to embracing fatherhood that the mere thought of talking about it is just uncomfortable. I give an example. This was still while we were still in person. I was working with a couple. They had I'm gonna go with like 6 or 7 month old. I don't remember how old he was at the time, but they had their child in the room with us, and I'm doing my intake, and I'm gonna come back to this as a recommendation also. So I'm doing my intake, we're walking through some stuff. So I look at mom and I go, how's pregnancy for you? And she talks about her pregnancy. She had a difficult pregnancy. And then I turn to the dad and I look at him and go, how's pregnancy for you? And I'm not lying. He stopped and he goes like this. He couldn't fathom that I had asked him how pregnancy was for him. And then the first thing he said was, no one's ever asked me that before. And I said, cool, how was pregnancy for you? And he went on to express that her difficulties connected directly with his difficulties. He talked a lot about powerlessness and how that felt because she was having a very difficult pregnancy and he was powerless to do anything to meaningfully support her. And he also talked about how he had no one that he felt comfortable sharing that with. And he talked about how at nighttime, after she would finally get to sleep, through all of the discomfort that was their second and mostly throughout their entire third trimester, that when he stopped and he breathed, sometimes he would cry, sometimes he would drink, sometimes he would smoke, but he didn't know what else to do with what he was feeling in those moments. So when I talk about what it means to start to become a father or enter that role of fatherhood, when I asked this young man, I said, what was it like for you? Not only did he not understand the question at first, but finding the words, literally finding the words, was difficult for him. And I want to be very clear. Him staying up late at night, him crying at night or smoking and drinking at nighttime, wherever that was, it absolutely affected her the next day. Because she knew when she woke up and he was not in the room with her because he fell asleep on the couch. Well, that wasn't fun. She didn't want to wake up that way. Or when he didn't sleep at all because he was up drinking all night. And now he can't be helpful to her in a meaningful way. That's not it. Or when she would ask him questions like, "Are you okay?" And he would say, "I'm fine." She knew he was lying. And that also hurt as well. Just like I'm sure it would you'd all imagine that it would hurt you when you're looking at your partner in the face and you say, "What's wrong?" And they go, "Nothing." You know they're lying. And also it's annoying. And it also can be hurtful too, because you know you are being lied to. Something else that a lot of fathers talk about is trying to determine their role and their space within the household, within the home, is, well, where am I supposed to sleep? Where am I supposed to do this? Where am I supposed to do X and Y and Z? And one example I like to give is a client I was working with for a little while. He talked about literally sleeping. Their child, I wasn't there, but I had one that did this, so I believe them when they say this. Their child only slept while actively nursing. That was the only time the kid ever slept. Otherwise, that baby wasn't sleeping. Now, I don't know if that's an exaggeration or not, but my daughter only slept when she was actively nursing, so I believe them fully, because I saw it. It's a fun time. But then the question was, well, do I lay down in the bed with her? Because she's actually really anxious in moments like this because she doesn't want to roll over and hurt the baby by accident or anything along those lines. So am I more helpful or less helpful by being in the bed with them? Traditionally, I would occupy these spaces. I would occupy this lane in my household. How do I find my new lane or renegotiate a lane when my wife literally hasn't slept for more than a couple of minutes over the last couple of months because that child only sleeps while they're nursing? So can I broach this conversation? And if I do, am I being a burden? So trying to find his space in the household weighed heavily on him. Relatedly, I highlight the incongruence in expectations. And this one, while I could easily say that this one was me, because it was me, but also this was very much a client, where this client, for the entire gestational period, knew their role, said, my job is to support her. I'm gonna give her everything. What do you need to eat? What do you need to sleep? What do you need? Everything. And would tell us in session, he goes, and when that baby's here, it's my time. I'm on it. I got this. Now, for those of you who are laughing, you know, I did try to warn him if it helps. But to be clear, I had a lot of that energy. Certainly for my first, I had a lot of that energy too. And when that baby came, and he said, it's my time, and I'm gonna feed that baby, I'm gonna do that stuff. And when that baby said, in the only way that newborns know how to say, I want nothing to do with you, all I want is her. He was devastated. And I mean that sincerely. Emotionally, he was devastated at the idea of not being able to engage with his child the way that he wanted to engage with his child, of not being helpful the way that he thought and wanted to be helpful. So I put that in the incongruence and expectations category. Is we think it might be going this way, but sometimes we find that it goes a very different way. And a lot of fathers that I've worked with don't even understand what way it's supposed to be. So all they have is whatever pre-existing narrative they have, and that's what they operate from. The last one, which I've talked a lot about, is that minimization of emotions, that idea of it's not about me, it's about them. And I've got some quotes from my research coming up soon that I think will highlight that better than I could through any story. But a lot of men that I've worked with and continue to work with over the years will almost always default to, I'm fine. It's not about me. It's about them. And I want to be very clear, to some degree, yeah, there might be certain domains that are and should be about them. And what is your place within that? How do we carve out space for that without taking away space from the others? So I'll just highlight something really quickly when it comes to research. not only is just, we don't know much about fatherhood in today's idea, but we also still operate from this rigid hegemonic idea about what fatherhood and masculinity is supposed to be. So the question, so when I approach my research, I'm trying to sort of push back on that a bit. What does masculinity and fatherhood mean today? What can it mean today? And that's what my goal was in my research. The study that I'm citing specifically was it's actually a mixed method study. I know I said qualitative, but yeah, it's a mixed method study here where I talked to a bunch of dads about their experiences. And I also gave them a depression inventory. I gave them the Gotland specifically, but I gave them a depression inventory to see what was going on with them and just wanted to see what was happening within fatherhood experiences, both in their narratives, in their stories, as well as in the data that they're sharing specifically. I'll add that this study specifically was with Black dads, but the research would connect that a lot of the findings that I have here, they speak to fatherhood in general, with the added caveat of the intersectionality component of the role of race and racism and all that good stuff. So what I did was I pulled a few quotes that I thought would be really emblematic of the fatherhood experience, and I'll read them as we go through it. But these are direct quotes from my participants. With regard to his mental health, this participant said, honestly, I wasn't thinking about me. During the whole process, I don't think I ever thought about myself. I don't think I ever thought about, outside of I want to eat and I want to sleep, the normal stuff. That's it. That's how he approached his mental health throughout all of the gestational period and all of the postpartum period. His approach to his own mental health was blinders up. I'm not thinking about me at all. Another gentleman that I worked with, we had been working, just so you know, we had been working a little bit longer together, so I think he had a bit more reflection on it, but he said, he sacrificed it. I sacrificed it. I put it all aside. I believed that my wife's needs and, my future child's needs trumped mine. How I felt mentally, physically, whatever. My goal was just to make sure that my wife had everything she needed now and everything that the baby needed. And it did affect me mentally. But I had to put it off for a short period of time. I knew that, hey, this is temporary, it's not gonna last, but I'd rather the baby come out healthy than anything else. I had to put my own off just so my wife could have a better experience. I empathize with that, and I think we all probably would empathize with an idea of saying, let's get through this moment as healthily as possible. And in hindsight, he could recognize the cost of that. Because when he did finally get into therapy, which was, his daughter was 2 or 3 at that time, the amount that had to come out, that had to be worked through, was profound. And something that doesn't really show up in this quote so much here is sort of this idea of almost pretending as if, as we do this idea of putting it all aside, that we're truly putting it all aside. When I teach counseling courses, there's an older adage within counseling that we say, you check your stuff at the door, you leave your baggage outside. We don't actually do that. Like, no one actually leaves their stuff outside. You are always you. Now, that doesn't mean that when you have a bad day, when you're feeling down, that you can't show up and do good work. But you can't pretend, we can't pretend, as if for some, if not many, that stuff that we brought in with us isn't palpable. Because anyone who knows you probably sees right through that. And sometimes, if the resources are too low, and I frame everything through a lens of resources, if the resources are too low and the day is getting a little too hard, well, if you started out here, well below baseline, and the hits kept coming, well, that's how we show up at our worst sometimes. So pretending as if, when we say we sacrifice it, when we put it aside for the benefit of them, pretending as if that's not felt in other ways, to me, I would argue, is not the way that we should be doing it. Other things that I found in my research, not gonna, just throw quotes at you all day, is that, again, reinforcing those positives. these dads really wanted to be there. They wanted to be present, and that's not just physically present, but that's also emotionally present. And they all talked about the joys of fatherhood, the role and the power and the significance of their identity as a father. I'll also add that while I'm still collecting data on the quantitative piece, I got a really good sample on this. But what I am noting is, and this is sort of congruent with everything we've been saying, is the dads who've completed my screening surveys, what we're noting is decreased reported rates and participation in counseling. In fact, folks who were in counseling before they were pregnant usually stopped when they became pregnant. That almost the epitome of deprioritizing one's needs, of saying, I'm doing some stuff for me. I'm trying to do that developmental work, that mental health work, but no, we're pregnant now. I gotta stop all that. What I also noted was increased reports in anger, in frustration, in irritability, and to a lesser extent, substance use. So, what do I think we should do? Where do we go with all of this? I've got a few things that I would suggest folks do. First, we have to recognize that a lot of these narratives, these historical narratives about fatherhood, they might still exist with folks today, and they might be very incongruent with mental health and their own wellness. So the first thing we have to do is acknowledge it, that even if in your household, in your family, in your community, these historical narratives about masculinity and fatherhood, they're not really present there, they're still present in society. And if they're still present in society, and I know this because you all know what those narratives are, so if you know what they are, you know they're still present here, we still drink a little bit of that Kool-Aid. It's still with us a little bit, which means it still might be with men and dads a little bit. We have to acknowledge and perhaps even look out for this idea that fathers might minimize their own mental health and wellness during the perinatal period, but also, I would even argue, throughout the entire pregnancy and birthing and postpartum process. There might be that minimization of self. And that's not necessarily a bad thing in all instances. We all sort of put our stuff down a little bit every now and again. But if that's happening consistently, if that's happening when there is significant distress on the inside, there can be notable consequences. I didn't want to share quotes forever with this, and I also, I said I was going to try to get you all your break back. So I also held a few quotes that I had locked and loaded in my notes here or in my head. I held a few of those back. But to be clear, I interviewed men who had severe symptoms of depression and anxiety. And there was one client or one research participant who talked about ultimately being hospitalized at about 7 months into gestation because that's how badly his mental health declined. And what's interesting about his situation was the thing that he felt worst about in that moment was that he wasn't trying to be home making it about her, making it about the pregnancy. If he's in the hospital, he can't be there doing it. He still wasn't thinking about himself. It still wasn't about him. I mentioned those archetypes, specifically the protector and the provider, that those probably still exist in many ways. And what I would suggest as we're thinking about those types of ideas and those archetypes is well, okay, they can still exist. I'm cool with that. I'm not entirely against that, but can we expand on them a little bit? Because this idea of being the provider financially, well, statistically, that ain't really the case anymore anyway, but also, is that what's needed in your household? Is it okay to be a provider of love, of comfort? Can we be that type of provider? If not the financial provider, can we make space for that? If we're going to be the protector, does it have to be just physical protection? Or can it be emotional safety that we put into that title? Can we protect in other ways? I also want to note, and again, because I operate from this sort of strengths-based or positive-based perspective, I want to highlight that fathers do find immense joy and satisfaction in what it means to occupy that role, that they want to be present within their family and have a positive impact within their family, and that they're adjusting, just like everybody else is that we are adjusting to this new space, this new time, and this new identity. It's an adjustment period for everybody. My direct recommendations to everybody in this room who is providing care to anyone within that family unit is straight up, I tell folks, ask questions. Don't just ask questions to one partner because you think it only affects them. Ask questions to all of the people involved in the system. And I think at a surface level, we get that that makes sense. But I think, this is my opinion right now, this isn't research, my opinion. My clinical opinion is that we've been conditioned to sort of separate those things. These are the mother's issues and these are the father's issues. And yes, there's truth. There are certain things that are just one person's issues, but they affect the other person usually. Like I said before, when your partner wakes up in the morning, they're cranky as heck, you feel it. It affects you directly. So if mom is in distress, physical, emotional, or otherwise, that will affect dad. And if dad is in distress, whether he's hiding it or not, it will likely affect mom. So don't shy away from asking dad, hey, how's postpartum going for you? Or how's the conception process going for you? How is gestation going for you? I would strongly suggest opening those doors and remembering that when we have the opportunity, if we can engage within the entire system, we can do big change within a system. Encourage involvement in everything. So brother shouted out earlier that idea of going to that birthing class there. I mean, that's an involvement piece, but encouraging involvement throughout the whole process is an important piece. Recognizing, hey, what are your ideas? And this is going into that third bullet there. What are your ideas about who you're supposed to be and how you are going to get involved? Let's talk about what you can do, what you can't do. Let's talk about what your expectations are, because again, I use this example quite frequently. If you're expecting that when that baby comes out, you're going to take over and take lead and do all, well, maybe that'll happen. I've seen it happen before, but also only person who's going to determine that is the baby. And the baby will let you know who they want. And sometimes it ain't you. And how do we manage those expectations about what it means to say, this is the type of help that I want to be? I often tell folks, perhaps change the question of the type of help you want to be to what's the right kind of help. Because the type of help you want to give might not be the right kind of help. Sometimes the right kind of help is feeding mom while mom is feeding baby. Sometimes that's the right type of help. I often give this example when I talk about mainly my first one. I don't know what it is, but my first one was very different. My second one slept like all the time. My first one did not. But the right kind of help that took me a little while to realize in my own little journey into fatherhood was when my daughter fell asleep, finally, we would have this system where I would grab her and the stroller was ready for her. I'd grab her, we'd get her in the stroller, buckled in, and I'd boogie, I'd just walk. Because she loved being outside. And if she was full and she was outside, and I don't know what her brain told her, and as long as I was moving, if I stopped, there was a problem. But if you moved nonstop, gotta keep moving somehow, circles if you have to, I could get my wife about 2.5 hours of sleep. Undisturbed sleep, like real sleep. That was the right kind of help. Now, that wasn't necessarily fun. I was getting a lot of steps in. I was walking for about 2.5 hours nonstop. Again, you have to keep moving, right? So keep moving. But the question there is that the right kind of help? And in that moment, for those few months, that was the right kind of help. Can I make space to allow myself to say, well, I really wanted to feed her for every feeding and give a break that way. I really wanted to be the one to put her to sleep because now I can be helpful. But all of those ways of trying to be helpful were the wrong kind of help. I could try, probably wouldn't have worked. Probably been a lot of screaming. And if the baby's screaming, now everybody's upset. And also my feelings are hurt too. So now I'm sad, which means my sadness is going to affect everybody else's sadness, and all the wrong kind of help. So if we're talking about expectations, how do we move from the ideas of what we think is going to be helpful to what the right kind of help actually is? Last but not least, and this is sort of the biggest thing I think in some ways, is we got to get outside of this, of just the family unit. We have to look at the community. Strongly suggest peer support, professional support. This is a tough one too, because as I'm suggesting this, I want to be very clear. The hardest clinical group I have ever tried to run is now I'm emphasizing this, a free dads group. Anyone want to know why? I'm curious. I want to take a guess why it was hard for me to run a free dads group. Nobody came. You know the most amount of phone calls I got when I was scheduling up this dads group, and someone said, I'm thinking about this dads group. You know who was always calling me? Moms were calling me. Moms are calling me about the dads to get the dads in the group that I'm offering for free, and I still can't get them in. Even if it's virtual. Even if I grounded in video games. I did that, by the way. I said, yo, we're gonna play some games. We'll talk about that. No, can't even do that. I wanna be clear. I've had a few successful ones, but there has been no group that has been more difficult for me to maintain than a free group for men to talk about fatherhood. How do we get community involved? How do we get peers involved? Yes, professional support, bring them to I'm not saying me, but bring them to a professional therapist, cool. But how do we also talk about what it means to have these conversations with the other men in your life, with the women in your life, with the caretakers in your life? I often talk about fathers and other fathers, right? Because there are fathers, and then there's people who, you know who they are. They serve as fathers. They might be your uncle. They might be dude down the street who just grew up, but it's like an other father or a father figure. How do we engage with these folks and sort of normalize these dialogues? This is not easy stuff. I'm gonna be very clear. This is like cultural shift type things, but they're really important because the happier and the more wellness there is within the family unit, the more wellness we will see within each individual member of the family unit. And sometimes that requires professional intervention. But I would argue almost always it requires the village. You gotta get these folks together. We gotta get talking about how do we be the right kind of help and the right type of support. And it starts usually with friends and family and community. So push those dialogues. I think I did okay. It's 3:04, so I got a little bit of time back. I'm happy to talk. Listen, I hope this was useful for folks. I'm happy to discuss any thoughts that you all have or whatever, however I can be the right kind of help to you all. And thank you for your time. Or I can leave. I'm cool with whatever. Oh, hey, what's up?
You still see clients?
I do, much less than I used to because apparently I'm busy. But yes, I still see clients, but significantly dialed back, especially because I'm remote and academia and life.
Do you have your license in Georgia?
I'm licensed in Georgia and New York.
You might know some.
Oh, hi.
I'm curious about the village part, because when they bring in additional family members or fellow friends and stuff, they tend to be like-minded people. So if, let's say the individual, the father, already comes in with some certain mindsets of like what it means to be a father, usually their village also agrees with those mindsets. How do you shift not only the conversation with that father, but also everyone they would probably rely on and like look towards for that support?
It's a good question. I'm not, in an ideal world, I'd be powerful enough to change those positions and those ideas. I am not that powerful. What I have been doing lately, though, is been showing fathers that there are other mediums that exist that show different conceptualizations of masculinity. There are, for better or for worse, I'm about to say something about social media, but there are a myriad of Instagram pages like the Dad Gang and pages that are dedicated to Black fatherhood, again, most members on Black fatherhood, just highlight gatherings of dads and imagery and stories of dads doing dad things. And that's the same as doing everybody else's things, just doing parent things. So in some ways, just seeing that there is space to have those dialogues, that people are doing it, that in itself can normalize those feelings at time, even if our immediate community isn't there. And it can also sometimes motivate us to think about support groups, or engaging with a therapist, or engaging with some free group that just can't stay running for whatever reason. Things along those lines are usually what I would go with. I point to social media so they can see that there's other ways of engaging with masculinity. And then I also nudge toward community-focused resources. And a lot of those social media pages that I would recommend, those tend to lead to smaller subgroups where they are having events and things along those lines. Yeah.
This was a very good talk. And the question I have for you is, I see that they are making a video of all these presentations. Will they be available for us to access, for us to use, let's say, in some other groups?
That's not a question for me. I think the answer is yes, though. Yeah. There you go.
Thank you.
Yeah.
I just want to say that was from a recovering therapist. That was wonderful. When I was writing a chapter on dads and homework. It was like, oh, they're not in uniforms, and black dads specifically.
Yes.
Not in uniform. I feel like you're one of those. I'm feeling all that same energy. But how much have you worked with birth workers or doulas in that?
So I'm happy to shout out my doulas. I actually got connected. This is, again, I'm only 2 years in the state of Georgia, and for whatever reason, I don't know, my brain sometimes is still in New York. But there's been a few practices, including my own, that have partnered with doulas, specifically doulas, but we also partner with primary care providers and OB offices and things like that to provide those types of mental health services. But my doula, who is now one of my best friends in the world. But my doula, when I met her, I think I had my own epiphany about the work that doulas do, and that has fostered a lot of engagement there. So the referral cycle is very circular between OBGYNs, doulas, and our mental health practice. There's a strong referral circle there.
Here in Georgia?
No, that's in New York, yeah.
Okay. But anyway, we need to talk.
Yeah, I appreciate you.
And I have a brother.
Okay,
Who I want you to connect.
we can do that. We good? Thank you, folks.